One of the biggest misconceptions that I see in the clinic is when I have patients come in and tell me that they have one leg that is longer than the other. They may have been given lifts in their shoes or insoles, but it actually has not changed their back pain. And in many cases, it actually made it worse. So let me tell you why patients come in and they have been told that they have one leg that's shorter than the other. So can there be a true leg length discrepancy, meaning the bones are actually longer on one side than the other? Absolutely, but that is rarely the case that I see. Most of the time, I see what's known as a functional leg length discrepancy. So here's your pelvis. This little bowl right here is called your acetabulum. This is where your femur sits. And most of the time, what I see is people have tension in all the muscles around this hip joint. So most of the time, patients come in and they have tension in and around all this hip socket musculature. So what does that do? It sucks your femur up into the hip socket. Well, that also will pull your foot on this side up and make this leg seem shorter than the other, because this space between the femur and the pelvis is sucked together. All right. So what do I see in the clinic with patients? So when this happens, what I see in the clinic is that patients come in, they have tightness on this side, and so it sucks the femur up into the socket. Well, to get this foot on the ground, then I have to kind of lean over it to get that foot on the ground. So then I have a tilted pelvis, and my spine, which attaches to that pelvis, is also tilted. So when you have that position, then you might be experiencing low back pain, you might have tension through the hip, you might get pinching in the front groin, you could even get tension and pain on the IT bands or the knees. This has really wide lasting implications all the way through that kinetic chain. So let me show you how I treat this tight hip area to actually even out the pelvis and even out the legs. So to release that musculature that's really tight around that hip area that we've talked about, we're going to use some release tools. I prefer to start people with a racquetball. It's the right size to get to these smaller hip muscles. A lot of people come in and they say, oh, I use lacrosse balls. It's too big to get to where we need to go. The other reason I like a racquetball is because of the density. It's a little bit softer. It's got a little bit of gibbous. So when I first start somebody, I'll start them with this. As we get more tissue extensibility and flexibility, I'll move to something with a little bit firmer density. So these are rad balls that I normally use in my clinic as well. And I'll show you how I like to apply these to the hip for that trigger point release. We're going to take this ball and work all around this hip joint. So I like to show patients two landmarks. So at the top of your pelvis, this kind of shelf right here. You put your hands right here. And then the other one is the hip bone on the side. We are going to work in between this area. So you're going to take the ball and we're going to work here around this zone. You can feel free to also work back towards that back hip area, kind of the back pocket of your G zone. That's okay to do too, but we're going to focus today in between the top of your pelvis and the side of that hip bone, right in between here. That's where I find is really the important point to work when you have one leg that's shorter than the other. So you're going to take this and you're going to put that in that spot, lean against the wall. And so what I want to do here is I actually want to put my weight on the other side because I want this leg to be relaxed. I want the racquetball to be able to sink into the tissues. If I'm standing on this leg, that ball can't sink in and can't help mobilize these tissues. So you want to be relaxed in here so it can sink in. So I'm going to lean against the wall and I'm going to go back and forth. I'm just rolling, kind of assessing where do I have any tightness and any tenderness. And then once I find a spot, I want to rest on it. Now, there's a little caveat. I want that spot to be 3 to 4 out of 10 on a symptom scale, nothing more. If you're at a 7 or 8 out of 10, those tissues are not going to release. And that is one of the most important parts of this treatment. We want your tissues to soften, so less can be more. So I'm going to breathe into that zone, let those tissues soften. So either you feel the tissues physically deflate, or your symptoms might go from a 4 out of 10 to say a 2 out of 10, something of the sort. So when that happens, then I'm going to just pivot my knee in and out. You'll notice your foot moves almost like you're squashing a bug. And you're just doing this rotation, nudging back into that tension, because as you move that leg, that tension or tenderness is going to come back. So I'm just going to rock in and out of that 10 to 15 times, getting that to soften and release. and you'll notice it'll start to open up. You don't get those restrictions as much when you move your leg. And once you get that release, then I might move to another spot or find 2 or 3 spots to work on. So really working on opening up those tissues around this hip area. So again, top of the pelvis here, side of the leg bone here, we're going to work in between that area. And that will really help decrease that femur from being sucked up into the socket. It'll give it some space and some give, and that's going to help even out your legs. After you've released that hip musculature, then you want to stretch. So you're going to cross your ankle over the opposite knee. You can start by leaning back, walk your hands forward till you start to feel a stretch in that hip. If you don't have a stretch here, you can walk your hands forward, but really you just want to go until you start to feel the stretch. You're waiting for that to soften and release again. From here, I can even pivot my shoulders towards the knee that's bent, or I can hinge forward straight, or I could actually even turn towards my foot that's crossed over my knee. That'll really help isolate those particular areas that are tight and tender. You want to get specific about where you're releasing along that hip zone. Next, we're going to use some of that rotation that we've just created after the racquetball release and the figure 4. So you're going to be on your back, knees bent, and we'll go into windshield wipers. So lying here, you're going to let your knees rock to one side and then rock to the other. Going back and forth, you can do about 10 on each side. You're trying to keep that pelvis on the ground as much as possible. It will rock a little bit and lift a little bit, but you really want to isolate that rotation right at the hip joint, because again, we're trying to open up that hip where that femur is sucked up. If you need a progression from here, then you can do what's known as shin box. So you're going to sit with your hands behind you, feet wide, knees wide, and you're going to rotate your legs side to side. So these are other windshield wipers, just in a more upright position. Okay. Of progression further from these windshield wipers, this is truly shin box, where you pivot one side, you get kind of a 90 degree angle with both knees and shins, and then you can even lean forward. Come on back, switch to the other side, and lean forward. Okay. This is a great program so far. Yes, to address when you have one leg that is functionally shorter than the other. It's also just a great hip mobility program in general. Now I'm going to show you how to finish up with some hip distractions. You'll need a band and something to attach it to. So I have a band that's attached to a weight right now that's going to allow me to pull against that band. What I'm going to do is you're going to put your foot inside of that, and I'm going to bring the band right up to your hip crease. From here, I'm going to go onto my hands and knees. I can walk forward. The band wants to pull me back. I'm going to walk forward so I get, about a moderate level of tension. From here, I'm going to go down onto my elbows. This will keep my torso over my shoulders while I can let the band pull that hip back this way. And then you're going to breathe, really letting go of that hip without moving your shoulders, okay? And use your breaths to really relax that hip zone. So what we've talked about is that femur really gets pulled up into the socket. So with this, we're really trying to kind of open up, pull that femur down and away from the socket to give that hip joint more space. This is really going to help level out your pelvis, center your femurs. It will decrease the compression in the front if you get pinching through here, and help alleviate back pain, because a lot of times we get that compression, it tips the pelvis and goes straight to the back. So we want to open up all of those segments. Thanks so much for letting me help you even out your leg length. Let me know if you have any questions or want any other topics addressed. I'm happy to personalize therapy to you.